Hello everyone, I am Dr. Aliza Shahid and I am an online moderator for Dental News Pakistan. Today we are going to be talking to one of the prestigious doctors in Ireland, and I think she has achieved a lot of milestones in her life. And one of his, which I came to know, is that she just graduated her MBBS after dentistry. So let me ask her to introduce herself, please.
Assalamu alaikum everyone. Bismillahirrahmanirrahim. Thank you very much, Dental News, for giving me this opportunity to speak to my viewers today. As you all know, my name is Syeda Amna Azim. I graduated from Fatma Jinnah Dental College, and I've completed my house job in Fatma Jinnah as well. Further to my post-graduation and my internship, I moved to UK, and I completed my 3-year post-graduation from Eastman Dental Hospital, which includes 1 year of clinical diploma sciences certification for 1 year. And also I completed my 2 years master's degree from University College London. During that process, while I was studying, I tried to utilize the time efficiently, and I managed to get through my membership exams, which is MFDS and MGDF, through Royal College of Surgeons of Edinburgh and England. After my 3-year post-graduation, I worked in various oral maxillofacial surgery units across UK to gain experience within the specialty. Further to that, I moved to Ireland for my specialization examination, which is like fellowship in oral maxillofacial surgery, and also to gain some experience in Ireland. So I worked as a registrar in oral maxillofacial surgery as well. I was fortunate enough to secure a place in medicine and have received my degree recently, which is in Bachelor's of Medicine, Bachelor's of Surgery, and Bachelor's of Obstetric from the University of Dublin.
That's so amazing. Let me ask you, after BDS, why did you go for oral and maxillofacial surgery specialty?
Sorry, can you repeat the question again?
After BDS, why did you specifically go for this oral and maxillofacial surgery? Why this specialty only?
Well, as I already explained to you, that my passion began with oral maxillofacial surgery when I was doing my dentistry. So I would say this is a very good question. And the answer is that I did not choose the specialty. The specialty chose me. I remember the time I was completing my house job in oral maxillofacial surgery in a civil hospital with Dr. Mirza Muhammad Shakir. And during that rotation, I had a chance to volunteer with Korean Cleft and Palate Association. And I assisted with the team and operated on a few of the children with cleft lip and palate. And that was kind of a defining moment in my life. And since then, every step I took echoes my thoughts from the time I worked in that department. And alhamdulillah, I haven't deviated from that goal, regardless how much obstructions I have faced. I just have this strong faith that Allah subhanahu wa ta'ala has destined this pathway for me. I'm just following it. And like I mentioned about the civil hospital thing, it was a very defining moment because they were a team that came to Pakistan to operate on the kids. It was a charity event basically, and there were so many people who gathered outside the hospital to get their children's operated. There were probably thousands because it was advertised in the newspapers that there'll be a team coming from abroad. So many people gathered outside, and my first task during that charity event was just to manage the queues and assess the children with my senior consultants and all. And that was when I realized that hopes of many will be declined, because obviously not everybody will be able to get their children operated, because there were only 50 slots and we were making sure the most serious and the significant one should be operated. So when I saw people being turned down, obviously because of the resources and opportunities, that we had very limited resources there, I felt that this is something I would come back, inshallah, one day and complete. So this is what my calling is. And alhamdulillah, I'm trying to pursue and work in the same direction. So let's see what future holds for me, inshallah.
Inshallah, mashallah. A very inspiring thing. Everybody needs some, spark to start and go up. So I see that you have done your MBBS after your dentistry. What intrigued you?
Well, like I said, that this is something very important for people to be aware of. And I think it is more like a lack of awareness, or maybe it's not like people are very much aware of the pathways that how things work. So basically, just to let you know, to progress within the specialty, you must be dually qualified. Hence, the second degree is an essential requirement. Now, I applied to several medical schools, and I had a fair share of rejection as well. But then the key point is that I never gave up. And here I would say that it's my perseverance and determination which helped me keep going. And this is what it is, to be honest with you. That's why I did my MBBS after dentistry. Because at that point, I mean, like I said, since my house job, I was sure that I want to do, inshallah, maxillofacial surgery in my future. So my every step that I took since my graduation or since that defining moment, I made sure that it's just followed through. So that's why MBBS was one of the most important requirement to excel in future. Because if you don't have second degree, or if you aren't dual qualified, obviously you can't progress in the specialty. You're stuck at certain level, and that's it. So which is why this was very important.
Yes, for a growth, it is really important for each and every one of us. So, can you just explain how is this journey for you? How it was for you. How there are a lot of certifications you have earned, lot of I think degrees you have earned. So, can you explain briefly?
Lizzie, like I mentioned to you earlier, that being a international trained dentist, obviously things are a bit competitive because you're competing with the local graduates when you're applying for degrees and applying for further positions and all. So you have to make sure your credentials are up to mark. And when you're actually working and when you're in a training process, you have to make sure that all boxes are checked, that you have all the requirements. That's one of the essential criteria for applying for medicine. You have enough experience, you are competent enough to actually embark on that journey. So when I say, or when you say that you've done so many degrees and qualifications, so that was something that was a requirement. Like basically, to begin with, when I started my diploma clinical dental sciences at Eastman Dental Institute, that was my first step. That was most like my stepping stone kind of thing. Since then, obviously, once you get into the system, then you make your own space. You don't have to elbow anybody. You just keep growing. If you're competent, if you're hardworking, and you know your stuff, then definitely opportunities do come your way, and you just have to know when to avail them. So that's why when I was doing my master's, when I was doing my further post graduation, I thought, because I'm studying anyways for those degrees, so why not just get my MFDS or MJDF done at the same time? Because it was the same curriculum. Like I said, dentistry is not different at all. In any part of the world, it's the same. Like you read same restorative books, you use same oral surgery books, but it's just how you practice it, how the guidelines, how you manage it, and then that only comes when you are actually in the system. Something you can't just learn by books. So my journey, actually, I know it's very long, but it feels like it was worth every single day. It was hard. It wasn't an easy feat, but then, like you say, when there's a will, there's a way.
So true, so true. You just need a goal to just move on and then aim towards it and then move towards it.
So you have to set a goal.
True, so true. So how did you manage your family and your career? Was it difficult for you?
Well, again, thank you very much. I think that's a very good question, and I have a lot to say about that. First of all, like I said, that when there's a will, there's a way. So I think you unintentionally practice what you observe in your family as a child. So I did mention briefly, I think, that both my parents worked for Pakistan Television. My father was one of the religious producer, and my mom, she actually worked, and she had the honor of being the first announcer of Pakistan Television. Was Ali Yasmin is her name. So basically, she doesn't work. Like, what I would say is that I have seen her working more and managing the work-life balance. So when I've seen my mom being juggling with the house and family and also managing the balance, then actually you automatically learn from your parents. So I saw my mom working and managing the family simultaneously. So the true inspiration comes from her, to be honest with you. She maintained the balance between the family and pursued her career as well. So I think it's a bit natural to have learned the skills from her. So I don't think so that I know it's difficult when you have kids and when you have other responsibilities, but I think, alhamdulillah, for me, I was a bit fortunate that I had a very strong family support. And secondly, it's you yourself who have to determine what's your priorities. So obviously, family is always a priority. I had to manage my family. There's no doubt about it. But then there's no way that you cannot strike a balance. But you have to maintain, and you have to make sure how. And everybody has their own personal circumstances, so there's no one answer fits all kind of thing, But I say, if you put your heart into something, definitely it's doable. It's doable.
Right.
Yes, sometimes things do
Definitely.
suffer. Sometimes things do get take a backseat, but then you have to set your priorities.
True. When I have seen many people just going towards career and they have not bent towards the family, which disrupts your life also. A balanced life is very important for a good, healthy career and yourself. So
I think what you need
yeah.
is a huge support. The most important thing is the support mechanism, the friends, the family, your immediate family, your distant family, your siblings, your parents. This is the huge support that actually helps you to grow. Because if you have the stress hanging over your head that, oh, this is what it is, oh, somebody's upset with you, or you have neglected that person, somebody is not happy with what you're doing. So you can't really work with all that stress. So you have to have a little bit more freedom to choose what you're actually opting for. And once you've made your decision, make sure people are on board with you, like your family especially. Rest all, there'll be obstructions. People will be like, kya kar rahi ho, kyun kar rahi ho, kyun nahi kar rahi ho, koi zarurat nahi hai. You'll hear all that stuff. Lekin if you know what you're doing and what you want to do, then just go for it. I heard a
It's
lot. I
family
heard a lot.
support is very important.
When I was actually embarking on these master's program and all, I heard लोगों ने बहुत क्या ज़रूरत है? Why are you doing it? Why are you investing so much money into it? You're not going to gain anything out of it. Don't worry. Don't bother. Don't waste time. I'm like, okay, you know what? I think it's my life. I think I have a slight right to make a decision on my behalf. Please, thank you. So this is what it is. So like I said, suno sabki karo apni.
True. I think these are the people who drives us to go forward.
You take suggestion from everybody, because obviously it's in the hadith as well कि हर किसी से आपको मशवरा लेना चाहिए. आप कोई भी काम करने से पहले you should take some suggestions from people, and obviously your parents are more sensible than you, so they have seen life more than you, so you take their opinion. But then if they're on the same like if they're on board with you, then obviously you don't need to bother about the rest of the world. As long as your parents or your siblings are by your side, that's it. That's all you need. And yes, if your partners are by your side, that's as important as well. You can't just ignore your partners and your husband and wife, for sure. No, and your kids.
Yeah,
That's important.
So true. So was it difficult for you to pursue MBBS in Ireland?
Like I said, obviously it was competitive. First of all, getting in was a very challenging process. I had a fair share of rejections. Obviously, they do look into very minute criterias, like details that, oh, if this certification has been done, if you've done this, if you have this experience, because you're competing with their own local grads. And then secondly, there's a huge financial implication to it. It's not like just, okay, you wake up one day like, okay, fine, chalo, aaj maine medicine ka program bana liya, I'm going to start medicine. No, you have to make sure, obviously it's a financial implication. You have to have funds. You have to make sure how you're going to manage yourself, your like your finances, your degree. So it was a bit challenging, because I was a self-funded student and I was a mature student, because I had my previous degree. So you don't get much finance or much help abroad in the country if you already have a degree. So when I was embarking on this journey, I had to be very careful that whatever I am going for, do I have enough support? Do I have enough funds in my pocket? So, and then obviously, like sometimes you say that Allah is there, obviously, inshallah, Allah helps everybody. So for me, it was more like a decision that, like, I wanted to do this for so long. And when I had this opportunity, I was like, I'm going to definitely, inshallah, go for it. And I know that Allah will help me some way or the other. And it did. And alhamdulillah, he did. So yes, I was working simultaneously while studying, 5 days studying and working on the weekends. obviously I had to pay my bills and I had to pay my fees and everything, because I didn't want to bother my family as much. I already did for my postgrads, because they were like, "Kabhi settle hogi ki nahi hogi? You're never gonna stop studying." So obviously, every time my mom's asked me like, "Okay, now next, what's the next degree you're gonna go for?" She knows that you know what, I can't sit idle. I have to do something. So yes, it was a bit challenging, to be honest with you, in terms of work and study, because the rest of all the other students, who do medicine, obviously they sit at home. They have parents there, so they don't have to worry about how I'm going to pay my fee, how I'm going to do my other finances and all, and how I'm going to balance studies and work together. So that was a bit challenging for me from that point of view. But alhamdulillah, apart from that, studies and all, no, because we did do well in our dentistry back home. So anatomy, physiology doesn't change in any part of the world. It remains the same.
Yes, true. So, who was your role model in all of this journey? What is I think, your dream to become a doctor?
Right. Okay. So yes, that's a very, very sentimental question. So basically, I was raised by my khala. She was a doctor, and she was a major in Pakistan Army. So she was a surgeon. So I was raised by her since I was a child, and you can kind of comprehend the kind of upbringing I might have had because of her. Obviously, very strict. She was a woman, very strong headed woman with high morals and character, selfless soul, I would say. And to sum it up, she was a woman of substance, to be honest with you. And if I be honest, I just want to follow her footsteps. She encouraged me at every point while I was in my healthcare profession since I was a child as well. So she tried to convince me in every way possible that, look, this is something very prestigious. This profession is important for women. They should actually contribute. So she always advocated for women empowerment, and she wanted to make sure that women contributes. Even though back then when she graduated, there were very few doctors, and like female doctors weren't very the number weren't very high. But alhamdulillah, my khala, obviously, and my nana and my nani actually supported all the girls, which is why all my khalas and my, obviously, including my mother, they all are all professional women. I mean, like, you can't imagine in those era that women will be like working in the army, or they'll be doctors, or they'll be in the media. That was a kind of a new thing back then. But like, obviously my nana supported them, and that's why they are who they are. They became very strong-headed women. So she was my inspiration, to be honest with you. So during all my academic success I have achieved so far, it's all because of her and both of my parents' prayer and support. And I just don't know how can I even be close to her what she was. She was a gem of a person. She was a woman of substance. May Allah bless her soul. She's not with me anymore, but her prayers are always there with me.
Ameen, Ameen. So, on this note, would you like to give any share your views about women in dentistry?
Yes, again, I would say that female representation in dental profession is very important, to be honest with you. Things have changed a bit since the last decade, and I would say they all change for better. So women do have special place in dentistry, and it can benefit dentistry if women can be accepted and be provided with the opportunities to be effective leader, someone who has excellent communication skill, which I believe is required to obtain and maintain the success. So treat them with respect and equality. Women wish to work in an environment where gender difference do not deter development progress, opportunity, or advancement. And female team members flourish in an environment where they do are respected, and their talent and experience and ability and potential are equally acknowledged. So I would say that for women, dentistry is a quite noble profession, and it also helps you to maintain the family and work balance, to be honest with you, because with dentistry you can actually set up your own hours, and you don't have to do like night on calls and all that stuff. Like, I tell you a little story. So when I was in the UK, I remember that was my like first year of on calls that I was doing when I was working as a MaxFax SHO. So my dad used to ring all the time to check like how are things and if it's okay. And then there's a 5 hour difference from Pakistan and the UK. So that's the understanding of people of about maxillofacial surgery. So he was like, okay, fine, I understand you're on call, like it's 3 o'clock in the morning, but please, can you explain me who comes at night at 3 o'clock to get the tooth out? So for him, it was completely different because he was a media guy and he thought that I got my daughter graduated as a dentist, and dentist is like 9 to 5 or maybe 9 to 4 and weekends off and chilling and, having a good time and holidays. And he's like, what the hell? How you are just working like 4 o'clock in the morning and telling me, yes, I'm on call, I'll talk to you later. So that was very hilarious. And then I sat him down one and said, look, this is what the maxillofacial surgery is all about. I know I graduated in dentistry, but things have changed. This is one of the branches of dentistry, like maxillofacial surgery. So yeah, so for women, I think this is quite a noble profession, and they should take this opportunity if they have the chance.
Yes, and it nowadays it has a good growth also. You can go in
Indeed.
different direction and do
Things
different
have changed.
specialties.
Yes, indeed, it is. It is very. And then I think there's so many opportunities nowadays in general dentistry and specialization. There are more opportunities, and women are more welcome because of the the latest awareness, recent awareness that's been created. So women are more accepted, and people have accepted their capabilities. Not like, oh, no, you're a woman, you can't do this. Sorry, you're a woman, you can't be a surgeon. Oh, you're a woman, you can't be this and that. So things have changed. So that's why I'm saying that it is something that women should consider seriously.
True. So I've heard that you are associated with the foundation, Smile Spreader. So I would like you introduce it and tell our viewers about it.
So obviously, I'm sure my class fellows, if they're listening, they know that I always was tagged as a smile spreader for various reasons. So when I moved to Western country, I realized that there was a lot of things going on, and recently we heard a lot of voice was raised about this discrimination and racism and all. So this actually organization is to do with integration. So what I thought about was to provide a platform to minorities and non-minorities to come together on the same platform and share their experiences, because it's just a general concept that people assume that the people in the West doesn't have any problem, they get everything on the plate. But no, that's not the correct impression that people have. They definitely have their fair share of troubles. They go through a lot of hindrances and obstacles as well. So this platform is all about creating integration. So what we do monthly webinars, and we share the stories from minority and non-minority backgrounds, and we try to actually provide a solution as well, because if somebody is listening, they have a solution to it, or maybe they're from some kind of organization who can actually help them to answer their questions. So this is what it is. It is all about creating sense of belonging within the community to have a diverse society. And the another one is called APS, which is All Pakistani Physicians and Surgeons in Ireland. It's an organization which is associated with providing a platform to all Pakistani doctors residing in Ireland at the moment. So APS Europe is a huge platform. It has a lot of branches like APS Sweden, APS Europe, APS Japan. So there are a lot of branches, APS UK. So we do conduct like regular webinars, teaching webinars. We do citizenship informations can be provided to people, because it's more like when you're sitting at home, there's a one platform where you can go and you can get answers to. So this is how it works basically. So that's for APS Europe, basically providing welfare support, providing educational support, career support. So this is all APS is all about. But whereas Smile Spreader, which is my personal organization, so that's something to do with integration, making sure people are well connected and well integrated, because there's no place for racism or discrimination in this world anymore. So this is just, and I'm happy that I have got a lot of positive response from my non-EU colleagues, or from the non-minority colleagues. They literally take part. Actually, we have a meeting in few days' time as well. So looking forward to listening to more stories actually. So yeah, it's a good platform. You can join. You can come
best of luck to you for that.
You can come and listen to our webinars anytime.
Definitely. I think our viewers will also enjoy, and It's a very nice thing, like we are encouraging minorities to come up and share their problems. It's a very nice initiative. So what message would you like to give to all your viewers out there?
Well, I am not going to give you a sermon like everybody keeps saying, oh, you should look into the education prospects and all. I'm not going to give you any kind of academic advice. I'll just remind my juniors and my colleagues there's one thing that's very important, and I think we are lacking nowadays. And unfortunately, I don't know, it's just because I think we've lost the touch with our traditions and our values, probably. So my first advice to all my colleagues and students are that to always respect your teachers, because they are the source where you gained your knowledge from. And be honest to others, be fair and transparent in your day-to-day dealing, because at the end of this life, we have to revert back. We must revert back. Surrender to Allah's will, and if you do, you will be blessed at the end. And this is what I want to tell people. There's something very important and very close to my heart, which I keep sharing with people, and I'm going to share with you as well. I might have to narrate this in Urdu, because this is actually this helps me keep going. And when you read this and you're like, okay, fine, you know what am I struggling for? Eventually, whatever happens is it's destined. So it's a hadith qudsi actually. It says, "ए इब्ने आदम, एक तेरी चाहत है, एक मेरी चाहत है. अगर तूने पैरवी की इसकी जो मेरी चाहत है, तो मैं बख्श दूंगा तुझको जो तेरी चाहत है. अगर तूने नाफरमानी की इसकी जो मेरी चाहत है, तो मैं तुझे थका दूंगा उसमें जो तेरी चाहत है. बस होगा फिर भी वही जो मेरी चाहत है." So it's very clear message. It says that अल्लाह ताला के ऊपर अगर आप अपने मामला छोड़ दें, तो अल्लाह ताला आपके लिए रास्ते खुद बनाता है. तो मैं आपको एक बहुत अच्छी इंटरेस्टिंग सी बात बताती हूँ, आप सरप्राइज होगी. मैं कभी भी डेंटिस्ट्री नहीं करना चाहती थी. I never wanted to be a dentist. That might come as a surprise for people. Like I said, my khala actually raised me and she was a doctor, so she always wanted me to be a doctor. So wo har niwale pe meri beti doctor banegi, you know, that kind of thing was instilled into my mind since I was like 6 years old till I grew up. So when I got into dentistry, I was so upset because I remember I used to go for umrahs and I used to pray a lot that, oh, Allah Mia, please, I want to get into medicine. You know, like when you know what you want to do from the beginning, so you keep praying and your every effort is towards that. So I used to pray a lot. And then when I got into dentistry and I was like, I got really upset. I'm like, Allah Mia, I prayed so hard, and how come this is happening to me? And I was really upset. But then my dad sat me down and he's like, look, there must be a reason behind it. So just accept it. You've tried all your best, you've given all your best. Maybe there's something hidden for you, you don't know. So I said, fine. With a heavy heart, I said, okay, fine, I'll do dentistry. And I did it. And it's not like I did it half-heartedly. I did it obviously with passion. So now when I've done this medicine, I realized that Allah Ta'ala was saying कि तुम एक मांग रही हो, तुम सब्र करो, भरोसा करो, I'll give you both. तो मुझे अल्लाह ताला ने डेंटिस्ट्री तो दी ही दी. मेरे डेंटिस्ट्री करने से मेरे लिए अल्लाह ने रास्ते आसान किए कि मैं मैक्स फैक्स से एक्सपोज हुई. शायद मैं मेडिसिन में होती, मैंने MBBS पहले किया होता, तो मैं शायद इतनी एक्सपोज नहीं होती इस प्रोफेशन के साथ, मैक्सिलोफेशियल सर्जरी के साथ. बिकॉज ऑब्वियसली व्हेन यू आर अ डॉक्टर यू गो इनटू सर्जरी, मेडिसिन, जनरल सर्जरी. But whereas even though I was a dentist, I was always associated and always attracted towards the surgical side of it. And to be honest with you, शायद मेरा patience भी नहीं है कि I can see tooth moving 5 years forward and 5 years backwards. That is something I don't have that much patience. I want to do things then and there. Get the tooth out, fine. Give the anesthesia, pluck it out. That's it. Pull it out. That's what it is. So I think what it was, and this is why I think I was more inclined to surgery as well, because it's an instant thing and you can provide instant relief to the patients as well, and you see results right away. So this is exactly what I keep telling people, that if you have done your best and still you're not getting what you wanted or what you prayed for, then wait, there's definitely a better thing for you in store. So this is, I think if people take inspiration from this, that look, I prayed. I remember I so many times I stood in front of the Kaaba and I was like, Allah Mia, I want to do medicine. I want to do medicine. I want to do medicine. Please, मुझे admission medicine में मिलना चाहिए. And when I did not get it, I was like, okay, मेरी वहाँ की दुआ कबूल नहीं हुई. There must be a reason. So, you know, बंदे को बाद में पता चलता है कि क्या वजह थी. And also at the end, From your platform, I want to actually thank all my teachers for their help, their guidance, support throughout, because without them, I wouldn't have been here where I am. And I cannot literally thank them enough. My institution, Fatma Jinnah Dental College, because of them, obviously, I know today they'll find out that, oh, I never wanted to do dentistry, but they'll know that I have done it and I did it very well. And not just dentistry, obviously, I progressed further. And I want to first of all thank my principal, Dr. Prof. Isa Rai. I think he's not retired probably, but he was definitely one of our teachers. Amazing person. Bakar Askari, another Dr. Bakar Askari, Dr. Asghar Mehdi, Prof. Saqib Rashid, Prof. Mervin Hussain, Dr. Inayat Padyar, Dr. Asghar Mehdi, as I already said, and Dr. Arshad Hassan. He was one of my restorative supervisors, basically. Now he's a principal of Dover Medical College, mashallah. And there are many more.
Mashallah.
Obviously, list is endless, but I want to say my special thanks to one person, and that is Mr. Mirza Muhammad Shakir. He was my supervisor, consultant in civil hospital. And because of him, I was literally exposed to oral maxillofacial surgery. And sir, thank you so much. If you're listening to this, I cannot thank you enough. And for all your guidance, for all your help and all your prayers. I know I did tell him, I called him when I got graduated. And he's like, beta, mujhe pata tha tum zindagi mein kuch na kuch inshallah zarur karogi. Mujhe pata tha ki tum karogi kuch, you are so passionate about it. And I'm like, sir, it's all because of your duas. And I did speak to my teachers as well. They were really happy. And the fact that obviously I was the first woman Pakistani graduate who had this opportunity. So alhamdulillah, I have a huge responsibility on my shoulder now to make sure not to let anybody down.
True, mashallah. I am feeling so inspired by you right now. It's like for every woman, it's a dream to achieve something and to contribute to a society something. So with that, we come to an end to our session. I hope you enjoyed our talk with Miss Amna, Dr. Amna, and this is amazing, like how she has inspired so many, got inspired others. So let me tell you, like these experiences are so valuable. These are very good insights for our young generation out there who is just finding way career paths. So I hope you all were inspired and got some good information. If you want to follow her, do follow her. Maybe she can help you also. Okay.
Please, by any means, I'll leave my email address for you all. If anybody wants any kind of guidance, any kind of help in terms of guidance in terms of application process, how to pursue career, we had a recent webinar, I think it's on the Facebook. So we did a webinar on the route to registration to UK, Ireland, and the USA. It was done 2 weeks ago, and I can share the link with you. That's not a problem. So you guys can view and watch whatever are your questions. I'm happy to take the question. In fact, there were 3 people in the panel. All of them are happy to help, and it's all voluntarily. There's no charges for it. It's all free of charge. It's just the idea behind is to help our juniors to progress as well. Because at our point, obviously, there were not much mentorship, not much guidance. So we've learned from our own trials and errors. So we don't want people to go through the similar difficulties what we've been through. So yeah, this is what is important. So please feel free to contact. I'll leave my email address with the Dental News. And thank you, Lisa. Thank you, Dental News, for giving me this opportunity. And yeah, thank you very much for your time today.
Thank you so much. I hope my viewers enjoyed this small session, and keep watching Dental News and subscribe, follow us for good content. Thank you.
Thank you.